professor of biology and the chief virologist at the Global Health Research Complex at Texas A&M University. Doctor, it's a pleasure having you on the program. Firstly, how much of an impact do you think would vaccinated children 5 to 11 have on the fight against the pandemic in the U.S.?
Yeah, a very large impact. So part of the documents that were given to the FDA were some epidemiology documents that show that somewhere around 30 to 40% of children in this age group have had COVID. And anyone who carries this virus can actually spread it among the people that they are around, so their families. We also learned from this that about 15% of the hospitalizations are from children in this 5 to 11 age group that will be targeted by the vaccine. And 2% of all deaths of children in this age group were due to coronavirus over the last year. So, from any way that you look at it, I think this is a potential for a very big impact, not just on the kids themselves, but in shrinking the number of people who can actually contract the virus and giving the virus essentially nowhere left to go.
Well, even if the CDC does sign off on this, they're going to face resistance. Many parents rather, won't let their children be vaccinated. That's according to a Kaiser Family Foundation survey. So how do you think authorities plan on getting past that hurdle?
Yeah, vaccination through school has been the way that we've done this in the past with polio and with smallpox and other diseases since. The Supreme Court has stood behind it, and really, it's a matter of public relations now, I would say, and that's where the battle needs to be fought. Science has done its job, and the vaccines work astoundingly well in children and are quite safe. So, really, it's just a matter of perception and getting that to line up with reality. And of course, that's always something of a challenge.
U.S. intelligence has just released a report saying they still don't know where the vaccine originated. Doctor, after all the
But
medical advances on COVID-19 so far, is it still important to have that information, you think?
it's important because wherever it came from, it can come from again. And so, most likely, this is going to be some sort of animal. Now, the way that the US intelligence community is going about this is probably not going to get the answer because the evidence for the rise of this virus is going to be genetic. And it's going to be found in the form of a sequence of some virus that is very closely related to SARS-CoV-2. We don't yet have any viruses that meet this criterion. Even the closest ones we know are about 50 years of evolution separate from the virus that we now see circulating around in people. And they keep looking at the Institute, but the Institute where they're looking opened in 2019. And so there just isn't a way that this could have happened in the way that people suspect. It's something that's going to be answered by science and really openness, and the largest possible number of people working in this field is probably going to be the way that we get the most results, rather than through sort of cloak and dagger intelligence missions.
All right, Dr. Benjamin Neuman, appreciate the perspective. Thank you.